Hi everyone, I would like to welcome you to the NextGen Healthcare and KLAS Research webinar. New survey shares what patients want from healthcare technology. My name is Nicole Scheid and I will be your host for this session. You may submit questions throughout the presentation in the Q&A panel in the WebEx window and we'll address all questions at the end. Let me introduce you to Cheryl Leibola, our Vice President of Patient Engagement Solutions here at NextGen Healthcare. And now I will pass it over to Cheryl.
Hello, my name is Cheryl Leibola. I thought I would start off by telling you about our learnings from a national survey that we conducted with Xtelligent Media. In this survey, we polled providers and the administrators, and we were asking them questions about healthcare IT and their adoption. And what we found in that survey is that they do believe that digital technology can help facilitate patient engagement. In fact, 95% of those said that they felt that the key to that was to have the provider engagement as part of that solution. And more than 60% of the providers stated that they were interested in healthcare technology that integrated with their core services. And that's from the provider perspective. Too often, the patients are absent in healthcare technology discussions when we're talking about patient engagement. And so that's why I'm thrilled to have this webinar for you so we can hear a little bit about the patient's voice and what they're saying about patient engagement and healthcare technology needs. My name's Cheryl Leibola. As was mentioned, I'm the VP of Patient Engagement Solutions at NextGen. We provide technology to ambulatory services and solutions. We also have a patient engagement suite. I am here today with my colleagues from KLAS Research, Adam Cherrington and Dan Czech. They are research directors and market analysis for KLAS. We'll be sharing some of their cutting edge research with you. So what are we going to talk about today? We see the agenda. We'll give a little bit of background about KLAS. And the reason I wanted to start with the ambulatory provider perspective is because there is an industry misalignment that has really driven the need for patient-focused research, because for engagement, there's the provider engagement and there's the patient engagement. We will provide a sneak peek of new insights for 2022. And the reason I say sneak peek is this report has not been published yet. So this is really breaking news, and it follows up on some of that misalignment that you'll hear from the previous report. As far as other industry trends, you may have seen some of this in the meeting invite. We'll talk a little bit about the trends for telehealth, some of the personas, and also what patients are looking for from healthcare technology and how are they making their decisions about which providers they participate with. We'll also talk about the digital front learnings. So digital front door is a term you may have heard. I know we've used it in our organization, and we've heard that it may mean different things depending on the organization or the person you ask. We'll save some time for Q&A and then we'll summarize at the end. So Adam, I'm going to turn it over to you to do some introduction and background on KLAS.
Sounds great, Cheryl. Thank you. Hopefully the sound's coming in okay. You can see and hear us just fine?
I can. I'm not seeing the slide transition, Nicole.
Yeah, let's have Nicole drive the slides if that's okay. That would be great. So, hey, we're so happy to be here. Thank you for this opportunity to share what we're hearing in the industry. This aligns perfectly with the KLAS mission to help our provider friends understand differences in technology, what's going on in the market. So we're grateful to the NextGen team for allowing us to present to our provider friends today, and very happy to be with you. We just want to take a quick moment and share a couple of details about KLAS. Those that may not know who we are an independent research firm dedicated to improving healthcare. And it's important to us that we share unbiased, accurate, honest information with the market. There's a good chance many of you we've spoken with before and you've contributed to our research. As you can see on the screen, we do a lot of interviews one of our favorite things Dan and I get to do, we're actually researchers at heart as well. And Dan leads our analysis and I lead the patient engagement research as well. And well, that's where we spend a lot of our time. We get to talk to many of you providers as well. So we hope and strive to represent your perspectives. And we've got some unique things we're sharing today that's brand new to KLAS that we've never done before, and we'll get to that in a moment. Just on this slide, we want to just share with you the quantity and breadth of things we try to cover, and it's ever growing. This list of categories probably becomes outdated every month. There's something new we're trying to understand based on what providers ask us about. So with that, there's the KLAS commercial for the day. We strive to help our provider friends, and we love to link arms with passionate vendors that care about this as well. So thanks again to the NextGen team for this opportunity. So as you can gather, I'm Adam Cherrington. It's my colleague, partner in crime, Dan Czech, and we're very excited about this. So Dan, this is one of our favorite quotes, and do you want to just explain why we start with this quote from Adrienne Boise?
Yeah, we use this quote. This is a few years old when she shared this. I'm sure Adrienne has shared this multiple times as she's spoken with the industry. But it helps ground us in our research, particularly the research that Adam and I do around patient engagement solutions. While there are direct benefits for provider organizations delivering these technologies, at the end of the day, we want the focus to be around the patient and how do these solutions benefit the patient in their everyday lives? Because selfishly, we're all patients. We're participating in healthcare as much as we try to help the industry. At the end of the day, we're going to have our own experiences. We want them to be great.
So based on that quote, we did some research a couple years ago. This came out minutes before the pandemic, I'll say, but we still feel that it was relevant and helpful at the time. And just briefly, we want to spend a moment on what we learned on this study. So Dan, and I'll ask your help to guide our listeners today, but this chart represents some of the misalignment that we heard from patients that we interviewed. So the orange dots represent patient priorities on technology. The black dots represent what you, the providers, told us were some of your areas of focus. And then we paired that up against some of the research we had already done with vendors to understand where they focused. So there's a couple things I hope we'll all gather from this chart. Number one is the patient's needs are very different than where we tend to focus. When we say patient engagement, are we truly thinking about what the patient needs? And some of the highest priorities here around arranging care, meaning self-scheduling, registration, check-in, prescription refill requests, those are not always tightly aligned with what providers and vendors told us where they were focused. So we thought that was really interesting. Even this upcoming HIMSS in a couple of weeks, I was looking yesterday at potential classes, and I think as an industry, we're still focused on the technology. We're still focused on what will help providers, and those are good things to do. Our message today is to bring the patient along and include them in those things that are advancing and so forth. I saw one class coming up at HIMSS that said, improve patient experience by cloud technology. And I thought, okay, that's interesting. I wonder where they're going with that. So our hope is that it's not provider or patient, but it's both. It's technology and provider and patient. So we want to point out that some of the things we learned on this chart, they were almost an inverse of what providers told us they were focused on. So on the next slide, you'll see a chart from another report that we did.
Adam?
Oh, please, Cheryl, go ahead.
Before we move to the next slide, I just wanted to kind of comment on this because this absolutely resonated with me and sort of our focus with NextGen when we were looking at some of the what we offer with arranging care being a top priority. So we've heard this also with some of our patient population from our patient portal surveys. So things like prescription refill request, top of mind, easy. And one of the things, we do offer an online self-scheduling tool. And what we've noticed is not all of our provider practices turn on the rescheduling. They offer the scheduling, but they don't do the rescheduling. And that was very interesting to us because we thought, well, you have the capability. So I think the point that the patients want that flexibility, but some of our providers may not yet be comfortable in turning some of those things on. So that really resonated with me with this study you did.
Really appreciate you sharing that. That maps very precisely with what we hear as well. So comparing some of those higher patient priorities with what providers told us they were focused on and their level of adoption, you can see it's almost an inverse of the previous chart. Scheduling, bill pay, check-in, these are things that we have access to but aren't always deeply adopting, to your point, Cheryl. So it's interesting to us that we have a lot of the things patients want, but are we prioritizing it based on what they want? So Dan, when we saw this, we knew we were onto something, that we had to listen to patients more, right?
It's interesting that development, some of these areas that are less of a focus, or historically have been less of a focus for provider organizations, there are some challenging aspects to this, and we recognize that. But it's not easy to flip a switch at an organization and turn on self-scheduling and rescheduling and not disrupt how things have been in the past. But this requires, to really focus on the patient, it's going to require some change management within the organization, perhaps new governance structures, standardization of scheduling practices. And that's just one example of that need, but it certainly exists. And we recognize this is challenging, but we're convinced that the outcomes will follow as you focus your efforts on the patient, really develop technology and implement technology that will benefit them.
Yeah, I absolutely agree with that. You know, in our research, in our journey to understand what's going on in the market, we came across an organization that required clinicians to open up their schedule for the patient self-scheduling. And although painful, or what they anticipated to be painful, patient satisfaction scores were going through the roof. No-show rates were dropping. And that's something we intend to go investigate further. We're working on what we were calling the Patient Voice Collaborative, where we intend to understand at an organizational level what patients want from their provider, and then compare that and do some benchmarking across the country and eventually the whole world. And so we hope to call out some of those best practices and points of light that we can share and learn from as an industry. And that's why we settled on the word collaborative. We really want that to be something that we can share with everyone. Let's jump ahead now to some of our research that's coming. Big asterisk on this slide. This is not public data yet. You are among the very first that we've ever shared this with. And so please act surprised if you see this in an upcoming press release, and we hope it's helpful. We're not going to get into everything today, but we want to just show you some of the similarities from the past study and some of the differences as well. So Dan, on this one, we got a little more granular, didn't we? We specifically got into scheduling, check-in, refill requests, and we saw some very similar patterns, didn't we?
Yeah, those top 4 or 5 areas match very closely with the research we did a couple of years ago. And it's interesting to see that the industry is, the patient perspectives haven't changed that large. There are a few nuances that are different post-pandemic and pre-pandemic, but largely they still want to be empowered in their care. And you look at what happened in the world over the last couple of years, I would be hard pressed, I would bet, if we surveyed our listeners today to find someone who hasn't used DoorDash or Uber Eats or a program like that. You, as a consumer, have come to expect a little bit more convenience in your life, and I think that's translating into what patients are expecting in their healthcare experience.
Yeah, absolutely. I want to call out a few things here. So this was gathered on a mass scale, and you can see that we interviewed thousands and thousands of patients here, and it's important to realize that for the first time we've got some demographic data, and we're going to show you that in just a moment. What are the groups that are experiencing high levels in each of these areas? And what else would they like to see? Dan, I know that we did see a shift on this chart compared to the last time we did this effort. Was there one or two things that jumped out at you that maybe shifted or changed that you want to share with our listeners?
Yeah, I think one of those that has become a little bit more back of mind for patients is finding a doctor. If you look at where we were 2 years ago when we did this, that was more top of mind. I'm not sure I can pinpoint why exactly that's happening for patients, but it's not as top of mind as other areas. That's one. I know the use of family and caregiver collaboration tools is one that you had mentioned, Adam.
Yeah, and I think there's a couple of reasons for that. We included it on this chart because we still believe it is critical for a core engagement strategy. You've got to have some type of caregiver and collaboration tools. And basically, we feel that outside of episodes of care, that's where a lot of the healing has to take place. And I think because of the pandemic, you're seeing a lot of emphasis on other things. We've just got a bright fire to put out. I've just got to communicate and get what I need immediately. And so some of the optimization, some of the longer term efforts to think on a broader scale for a patient's journey, I think we're going to see more of that grow over time, and including family and caregiver tools. So that was a shift we saw, but we still think it's something important for organizations to have. So great. So let's jump in and share a couple key learnings. Now, this actually is a chart from a different study, and we pull it in here to make a point. This came from a study that we helped publish and collect data for in conjunction with Chime. And we asked organizations year over year, what percentage of patients have accessed their acute care portal? And a lot of the data we're sharing in this upcoming report is from the ambulatory side, but it really paints an important point here. This chart helps us understand that as providers, a lot of organizations feel that patients are at least touching the portal at some point. Almost everyone is saying, yeah, our patients are using the portal. And it's an essential part of a strategy because it has access to the content and some of the things there. Some of the clinical data that patients need is what I'm trying to say. If you jump ahead to the next slide, if we compare that with what patients told us, there's really three groups on this slide. There's a third of patients that aren't accessing the portal. So we know that there has to be more. You have to account for those that either can't find what they need or need access to other tools. But you also have a third of patients that are saying, yeah, I am logging in monthly or a few times a month or a few times a week. So our message to you providers is you've got patients in different camps here. You've got to find a way to engage all patients. And if we hang our hat on one tool versus another, you might be missing an opportunity. And so, Dan, anything else that jumps out to you?
Yeah, as we've talked with healthcare organizations, I think something that sticks out, those that are really adopting a more advanced patient engagement strategies realize this needs to be a multifaceted approach. There are going to be patients that don't want to get into a patient portal, don't want access to it, or perhaps maybe have barriers of socioeconomic status or technology, their comfort level with technology. All of these things need to be addressed as you think through your strategy for engaging patients.
Absolutely.
Yeah. I think that's an excellent point. And one of the things, and I know this was asking the non-portal users and the portal users, we did a portal user study, and I think what surprised us is consistent with your data, which is the frequency of those who use the portal use it more frequently than we thought. More than half were using it more than once a month, so weekly and monthly, and that really surprised us. So I think it's an excellent point that those that use it, it's meaningful. Now you need to address those that may not use it and have a broader strategy to address those as well. So excellent learnings.
And we've found in this research that those who are the deepest adopters of the portal, using it weekly or a few times a week, 3 times a month, are in nearly every question that we asked about in this patient perspective study. They're the deepest adopters of technology across the board. They're going to be your highest users of telehealth. They're going to be your deepest adopters of self-scheduling and check patient check-in and registration, those types of things. In nearly every category. In fact, I'd be hard pressed to think of any where the non-portal users or the infrequent portal users were outperforming those that you get into. So you have that middle third that's using it between once a quarter and maybe once a year. How can you engage them at a deeper level through the portal to drive adoption? Or perhaps it's the other way around. Perhaps the other technology touch points drive the portal adoption. I don't know if it's a chicken or an egg situation here.
Yeah.
Oh, Cheryl, after you, please.
I was just say, great point. Go ahead, Adam.
We're going to see here in a moment that there's different degrees of collaboration patients say they have as well, and I think it's related to that. Let's jump ahead to virtual visits and share what we learned here. Again, preliminary data, sneak peek, some of this is subject to change, but when you talk to 11,000 plus patients, the data is pretty representative at this point. As we look at what percent of patients did something last year in the past year. So this data was collected in the middle of 2021. So it is accounting for the surge in telehealth and virtual visits. You still have about half of patients that have never done telehealth. And so it begs the question, well, where's that going to go next? We saw an absolute tsunami of use early on in the pandemic. It became one of the only options. And I feel like we're preaching to the choir. These providers know that. So we were interested to ask the question, if you've never used telehealth, what is your likelihood to use it in the future? So on our next chart, you can see that there is a good 40% of patients that are still saying, yeah, we plan to at least try this out. I'm definitely likely or most likely to at least try something. So what that means is you providers have an opportunity to reintroduce or introduce anew to some of your patients. There's a willingness there. And Dan, one of the things that jumped out at me in the study is we made some recommendations to organizations. You're going to have effective education tools. You're going to have to make sure language barriers are surpassed. You're going to have technical support at some level, whether it's provided through the vendor or on your own. But you've got a strong population that's willing to play here and participate this way. If there's anything we learned, it's that telehealth isn't going away. Right. It's absolutely here to stay.
And you look at the other side of this, which is those that had done a virtual visit over the past year, and the majority of those plan to maintain or even increase the volume of virtual visits. And we have that in this next slide broken out by age. I think it's really interesting when you start to dive into some of the patient demographics in this data. So you look at this chart and you have your youngest patients, those who may not have a significant need for healthcare yet. They're going to be comfortable with technology, but maybe navigating this process for the first time. And then you have on the other end of the spectrum, your oldest patients are perhaps a little less technologically advanced and a little more hesitant around telehealth. what I find interesting is those deepest adopters, those that plan to maintain or increase their usage of telehealth between 25 and 54 years old over the next couple of years. Those are going to be your elderly patients. Those are going to be, if you create a great technology experience for them now, think of the impacts 10 or 20 years from now as you've built that foundation and can build upon their technology experience.
Yeah, absolutely. It speaks to the wave of consumerism we see outside of healthcare that's creeping into healthcare in so many ways. I always use Chick-fil-A as an example, Dan, of they know who I am, they know how I'm going to pay for it, they know when I show up. You know, I'm used to that type of experience. I can get what I expect delivered to me quickly, efficiently. And then I go to my doctor, and it still feels like you're hiking through mud sometimes. And I know all of us want to see that improve. There's many reasons, and I think we'd be remiss if we didn't thank our provider friends for what they're dealing with today and what they've done the past 2 years. In all sincerity, our heart goes out to all of you. You've dealt with incredible challenges, and so it's. You know, I hope you hear the spirit of our suggestions here, that we want to align with patients, at the same time acknowledge how incredibly hard it's been and how incredibly well you've dealt with all of these things. So, all right, let's get back to the data here. So the next slide jumps in and talks about having a collaborative relationship and what we learned from patients there. Dan, do you want to walk us through this? What did you learn as you saw this data?
Yeah, so very similar to how we were talking earlier, the deeper portal adopters are some of the highest or most engaged patients. We find the same thing with, we asked in this survey, what is your relationship like with your doctor? You have a collaborative relationship where your doctor knows you at an intimate level, as follows you through your care journey, empowers you in your care, is more reactive as you need care. Your doctor knows you, but maybe doesn't have a deep relationship. Or do you have a detached relationship where you're going to go to whatever doctor's open, facility may not matter. But this ties through to so many elements of the way patients engage in their care. Those with the most collaborative relationships with the doctor are the ones that are having the best experience with the technology. In this question in particular, we asked around their virtual visits, how would you rate the quality of care? And those that have collaborative relationships, nearly all of them said they had an okay or better experience for the quality of care.
So when I see this chart, I think of the opportunity to meet patients where they are, help address the things that are important to them. The quality of care feels like it improves in the eyes of the patient. The collaborative relationship increases. I think there's great opportunities here to really truly engage in every sense of the word. Not force the patient to adapt to the organization, but let's adapt to the patient's needs, and there's clear dividends there. Let's jump ahead a couple of slides if we can. We want to go to, well, let's hit this really quick, Dan, if we can. In the report, those that will be able to see this, and by the way, we're happy to share this with any of you when it publishes the full report. Maybe this is just a quick example of how we were able to use the demographic data and really highlight some of the more high-performing patient groups. And Farrell, this goes back to our conversation on the portal. That are logging in and finding value, look what they're able to do. They are saying, hey, I like and appreciate that I can schedule my own appointment. So Dan, is it a chicken or egg thing? It's probably both, right? It's give them what they want, make it accessible, and they will use it. We've got some examples here.
Yeah, so I think a good example here. Let's bring ourselves in the shoes of our provider friends in the industry. I would take a look at this. This is specific to scheduling and rescheduling an appointment. I might look at these low-performing patient subgroups and think, how can I better engage my elderly population and help them schedule and reschedule their appointments. Or those that have a lower education level, a high school diploma or some high school education, or even a grade school education. Are there barriers that we've unintentionally created as a provider organization with our self-scheduling tool that maybe it's a literacy issue, maybe it's technology comfort level, but hopefully this gives some indicators or some areas to put some focus on as you consider how to reduce barriers for different portions of your patient population.
Mm-hmm.
And what I love about this, we did this for every question, and so there's going to be quite a few insights there. So, Nicole, can we jump ahead to slide 23? We want to make sure we get to some of the other things. I can't believe how fast our time's going here. Go one more if you would. And one more. So this is something we want to highlight and spend just a moment on. So we ask patients what they currently have access to in technology versus what would you like to have. So the light blue represents what they want to be doing online. Dark blue is what they're currently doing. Again, we've hit some of these themes already, but patients want more access to schedule. They want more access to prescription refills. Communication, they want to communicate more. I think that's fascinating. I imagine one of the challenges our provider friends on the call would deal with is just trying to connect with the patient. I think as we meet them where they are, there's opportunities there. And then Dan, talk about that fourth line for a moment. That was an interesting finding.
Yeah, so this is an item that we know is top of mind for provider organizations, patient satisfaction surveys, whether it's HCAHPS or custom surveys that are delivered to patients. When patients look at their technology experience, this is one of the things that's more back of mind for them that they don't necessarily want to do. And we feel most patients are happy to do that. But when an organization is looking, where should we prioritize our time and investment? This is certainly not the thing that your patients are the most want to engage with as they relate to your organization. They're going to want the things that empower them in their care. So this is an opportunity for the industry to find ways, even as you do patient satisfaction surveys, how can you do it in a way that engages the patients or reduces any struggles? Are there ways to reduce the number of questions to make it an easier experience for the patient? We know that the data that comes out of those surveys is so important and crucial for the organization as they strategize, as they seek to create a better patient experience. So we're not in any way suggesting not to emphasize those surveys, but
And Dan, I'm
reflection comes with this.
I'm curious if it would have been worded a little bit different. So what we've heard from quite a few of our ambulatory providers is when a patient is finding them, they are going on Google, so they're reading patient reviews about that particular provider, or they're sort of the reputation management side. So I'd be curious if in this study or maybe future ones, if you had anything about when you are choosing a provider, kind of the influence of online reviews.
Yeah, Cheryl, that is coming up. And I think that is something that organizations need to have a strategy for. Those tools we are being asked about them more often, even in the past 6 months. So I would say, yeah, there is some energy there. Go ahead.
I was just going to say, if we go to the next slide, we actually have some data around this from a patient perspective. So we asked, outside of the medical care, what do you care most about when you're choosing your doctor? We can talk through a few elements on this chart, but to your point, if you look at those bottom two elements, nearly a third of patients are saying, I prioritize the online reviews and the word of mouth that my family and friends are telling me about the physicians that they're using. So it does weigh heavily on the minds of the patient.
Yeah, that jumped out to me as well. So this is one I hope that would be useful for provider organizations to consider. I don't think you can up and move your location necessarily, but look what's number 1 and 3 and 4 on this chart. really key things you can easily control. Easy for me to say, but okay. All right, let's keep moving. We want to have time for questions, so I want to just share a couple other things. So that's some of the sneak preview of the patient voice report coming out in a few weeks. Again, we reserve the right to change things based on our final analysis, but I hope that's been helpful. This is a quote that I just wanted to share with the group today. This is on a call that I took from an executive director of marketing and experience, talking about patient access, and they use the word a little differently than how we've used it before, Dan. Simply the idea that you've got to simplify for the patient and consolidate the effort to engage and participate and really begin a relationship with an organization. Getting a patient in, make the experience easier, referral management, scheduling, appointment reminders, etc. We're hearing this theme over and over that we want to reduce providers want to reduce their technology footprint. They want simplicity of tools for the patient's benefit. And how do we do that? So I thought that quote was very telling, and I wanted to share that. This came out of some research and questions we did about digital front door, and we'll get to that in just a moment. The second part of this quote just emphasizes, yeah, portals are going to be a part of this strategy. They're going to become more of a transitional hub. And if you'll just advance one, we'll show the second part of that quote. Less of a transactional portal and more of a digital health hub. We still think this is the primary tool that can guide and help patients, but I think we've pointed out some opportunities that organizations can consider.
Mm-hmm.
Let's share a couple learnings from our digital front door report. This just came out a couple months ago, very fresh data. We did this study because we wanted to understand how providers are thinking of this. It's a term that's getting thrown out there. I think there's very little agreement generally what it means. So Dan and I went and interviewed 27 health systems and said, hey, what does this mean to you? Talk about the technologies that you're considering and thinking about. And some very interesting findings on this chart in particular, a lot of emphasis on the pre-visit part of the relationship, the marketing and the outreach and some of those SEO trends. We talked about social media and content and having a web presence. Overwhelming majority said their digital front door strategies related to finding and arranging care, right? And it goes back, this aligns nicely with what patients are asking for. Make it easy to schedule, make it easy to check in, et cetera, et cetera. Now, to go back to the Adrian Boise quote, what's interesting to us, if you look on the next slide, is a lot of these technologies that organizations talked about and the outcomes that they were chasing, a lot of it is related to what the provider's goals are. They're often provider-centric. That's great, and these tools can and should help with that. But our message is, hey, make sure you bring the patient along. Make sure you include and focus on their outcomes. Because as we've seen, if you focus on the patient outcomes, it ought to contribute nicely to the provider outcomes, right? So there are differences there, but make sure you include both. Anything else you want to add here, Dan?
I think it's important to mention, you shared that quote from a recent conversation about the patient portal becoming more than just a transactional touch point, but really a digital engagement tool. As we did this research on digital front doors, while we talked to 27 organizations and probably got 27 different definitions of a digital front door, what was consistent throughout was how integral the patient portal is to their digital front door strategy. Organizations primarily will look first to what is the extent of the capabilities I can get out of my patient portal, and then augment from there. And they may layer a technology layer over the top of the portal to create a consistent experience for the patient. But underlying all of that, to your point, is the portal, which has the access to that clinical information, serves as typically in a relatively easy to use way for the patients. So the portal is and will continue to be core to most organization strategies.
So last minute or two, and then let's get to some questions. We just thought it'd be good to share a summary of what are the other hot topics that we keep hearing about. Number one, patient engagement continues to come across our radar. Dan and I are busy, and we're happy to be busy, and we hope that we're sharing things that are useful for you as providers. That's the number one commandment at KLAS. Everything we do has to benefit the provider. So social determinants coming up a lot. Obviously, virtual care. We'll call that the resurgence that we know is coming, or the continuation rather. And then some other topics that are coming up often. We're doing more and more research on emerging technologies when there's a new capability or something. And so we've got some data there. But we thought that would be useful for the team, for the group here today to see that. So we want to make sure we can answer some questions. And Cheryl, let's turn it back to you. I hope we covered most of what we wanted to hit today, but was there anything we could clarify for our listeners today?
Yeah, and actually this is related to one of the questions that came in about some of the demographics that you captured in your report and your survey. So I know you shared some demographics on age and level of comfort with technology. The question that came up, was there anything related to the degree of illness or comorbidities? Did you get to that level of segmentation?
That's a great question. We didn't get to that level. One thing we do have access to, and there are a lot of breakouts, or will be a lot of breakouts in this report, is the specialty of the practice that the patient was checking in at. Well, we're careful not to collect any protective health information. We don't want to get too many details about the patient. We do understand where they were checking in at, so we can draw some conclusions for those specialties that often are treating chronic conditions or more acute conditions. So we see, for example, urgent care practices as some of those with the least engaged patients, and that makes a lot of sense. They're there for a quick transactional point of care. We see some deep usage across neurology patients and gastroenterology patients. Those are two that come to mind. So we'll have some breakouts around that. I think that's a great suggestion as we consider future research as well.
Mm-hmm. And I think you touched on this, especially when we were looking at some of the virtual visit slides, but related to what the sweet spot was. So you showed it by demographic and utilization, but I know one point you mentioned to me early on is you also have to have a need, right? It can't just be you're comfortable with technology, you also have to have a need. And how did that play in some of your results that you saw?
Can I take that for a second? Yeah. You know, one of the suggestions we had based on the data was help patients understand when it's appropriate to use a virtual visit and guide them that way. So the point is a good one, Cheryl. Maybe they don't understand the need, and maybe some of the hesitancy is, well, if I have to come in anyway, should I even be touching this? So we think providers can simplify that for patients, make it very clear. One thing our health system does is guide you and say, right when you log in, hey, if you have these conditions or you're in this situation, please use virtual visits. And I appreciate that as a patient. So it's a good one. And again, going back to that slide, if you remember when we said there's a good chunk of patients that are willing to try this. So we can get really good at instructing and educating and providing support there.
I think another factor into that middle-aged group that's engaging a little bit deeper with virtual visits is the family and the work situation that they're in. These are people in the prime of their employment that often are going to look for convenience of care over other factors. They are the ones who are having children and are looking at virtual visits for their children. So there's a lot of factors I think that play into that core middle-aged group being the highest adopters.
So one kind of comment, and I'd be curious to your thought, is when you were kind of saying the next topics that you've been hearing a lot about, and you talked about patient engagement, they were surprised that you didn't use the word consumerism. Has that come up in any of your recent discussions?
Oh, it sure does. Yeah. And maybe the way I think of it, and Dan, jump in on this, but patient engagement, are we a patient when we walk through the door? Is that when we could be a patient? Is everyone a consumer? I mean, we could use the word member engagement, employee engagement, consumer engagement, family, physician engagement. I mean, there's all kinds of groups there you could consider. So if we're all consumers, and then when we become a patient and have a relationship, there ought to be different strategies there, right? And then I think more broadly, consumerism is just what we're seeing in society. Going back to the Chick-fil-A example and the Amazon and Uber, and we just have so many options now. I'm blown away that I could pull up any movie, any song I've ever thought of in seconds. And so that's how we think as patients and as consumers. And so we absolutely want to see more of that as patients. If I can get a mortgage on my phone in minutes, can't I schedule an X-ray? Wouldn't that make more sense? And hopefully some of you have mastered that and can teach us so we can share it with other providers.
Well, and that kind of ties into this. I think this is the last question we have. Does the presence of technology help a cohort of patients actually become engaged? So now that there is a digital front door, now they will engage. Have you seen that?
So I'll give you a personal example. So I had a physician I went to for probably 10 years of my adult life. And the reason I went to that was similar to what we saw in our patient results. Their office was just about as close as you could get to our old building at KLAS. And it made it convenient for me to attend a visit and then show up to work. But I got to the point, especially helping lead our patient engagement research, where this was a small independent practice. They didn't have a patient portal. I wanted to be more deeply engaged in my care, and I wanted to do that through technology, and this provider didn't support that. So I went to a provider that was connected with our local health system that did have a patient portal where I could engage a little bit more deeply with technology. And it hasn't been all rosy. There have been things that frustrate me still with the technology. So I do think, it may not be that way in all cases, but I do think there is some desire to engage with technology that will drive some behaviors.
And I'm going to add a quote I found just a week ago. Accidentally ran into this quote by Steve Jobs about technology. And he said, one of the things I've always found is you have got to start with the customer experience and work backwards to the technology. You can't start with the technology and then try to figure out where you're going to sell it. The strategy for Apple started with what incredible benefits can we give the customer? Where can we take the customer? Not starting with let's sit down with the engineers and figure out what awesome technology we have and then how we're going to market it. I think that's the right path to take, he said. Boy, that just screamed off the webpage to me. Accidentally found that quote. I wasn't even searching for that. And so yes, I do think technology can enhance that. And it's got to be positioned correctly. You have to include patients in your delivery and rollout and promotion and things. So anyway, Cheryl, can we have 4 more hours with you and the team to keep talking?
I would love that. And maybe we come back and do a second one. I did want to say that one of them was actually a comment that they really loved having the perspectives of both the patient and the provider in sort of the same report. So they thought that was great. And they were interested in maybe some of the actual survey questions. Is that available in that report? And I know maybe you could talk a little bit about how folks could learn a little bit more.
You want to take that?
Yeah, we're looking, hopefully at releasing this report sometime in the next month. Ideally prior to HIMSS, but we'll see if we're able to pull that up or not. This will be available to all provider organizations that want access to it. Reach out to Adam and I, whose contact information is on here, directly through the KLAS website as well. We will have all questions that were part of this survey covered in this report. We covered some of the high-level topics today, but we asked specifically about capabilities that exist today in the patient portal, what patients want most in their patient portal experience. We asked across 12 different technology types, what do they care about, or what do they have today, what do they care about in the future. We go deep into telehealth that we covered today, and patient drivers to engage in their care. Did I miss anything?
I think you got the main things. Yeah.
Yeah.
Maybe we can end with this. Oh, pardon me.
I was going to say, and then you also have a podcast too that you'll be able to share some of these individual learnings as well.
Yeah, as you can tell, Dan and I don't have a shortage of things to talk about with this. It comes up daily. We get questions all the time. So we decided to have a podcast dedicated to listening to patients. And it's more than just, it's not listening to patients to measure their satisfaction. We don't claim to be experts there, but it's how do we include the patients more in this type of discussion? How do we ensure that their voice is heard? And so we invite anyone here to go listen to the podcast. We've overwhelmingly, most of our guests are fellow providers that are sharing, hey, here's what's working for us, and here's challenges we're having as it relates to involving patients. So we hope that's helpful. That's one resource there. So, well, in summary, we wanted to just share and remind everyone, already said, please include your patients as much as you can. We found some interesting things. Make sure the ones you listen to are representative of your patient populations. Sometimes those that are available and willing to share feedback, maybe they don't represent your general population. We want to ensure that you consider all the different demographics there, and some of the charts we had today are a perfect example of that. You've got different groups that have different needs, and as you consider that and optimize your efforts, you'll see value. And then one of the common challenges that we hear, and this reminds me of digital front door, as you said. Often organizations aren't unified themselves what they want to do, and so we encourage our vendor partners to try to assist where appropriate. We encourage organizations to unify their own efforts, and that effort alone ought to really create some momentum as groups think of how to do this. I'm convinced if we went to a random health system and said, what does digital front door mean to you? We'd get 10 different definitions at one organization, let alone many. And so that's really key. Anyway, we just want to thank everyone for their time and chiming in today and listening. We hope this was helpful. We want to thank the NextGen team and Cheryl. Thank you for this opportunity. We appreciate your efforts to listen to patients and share things with your customers. We love what you're doing and appreciate the chance to collaborate and share this. So, Dan, any parting words? Anything else you want to say?
No, I can't sum it up any better than that. I'm sure Cheryl has something she'd like to share as we close.
Yeah, just thank you both for your time. We really appreciate, and this research is very important. And so we appreciate your partnership with getting the word out. And yes, there will be a recording and slides from today available. So look for that. And thanks again.
Thanks.
Thank you.